My name is Conica Williams, and I'm a senior LPN to BSN student at Indiana State University. Today, I will be discussing a rising community health issue, suicide as a result of mental illness. At this moment, please take a second to show what you know and complete the pretest by following the link below. Now that you've completed the pretest, let's begin. We'll begin by discussing the population at risk. It is important to note that suicide is a major public health issue affecting different ages, ethnicities, and genders. When someone commits suicide, it not only affects the surviving family, but the community is affected as well. In 2016, males ages 45 to 54 had the highest rate of suicides in the United States. Of this rate, Caucasian males made up the largest portion of suicide. A man's experience of stressful events are related to aspects of masculine identity, which means that when a male is confronted with a stressful event, it makes him feel as though he is less of a man, and oftentimes is followed by thoughts of suicide and feeling like they would be better off dead or not here. Thus, our population at risk are Caucasian males who make up the largest portion of suicides. Upon completion of this presentation, you will be able to discuss what suicide is, who's at risk, what are the signs and symptoms of suicide, contributing factors, and suicide prevention interventions. What is suicide? Suicide is the act of deliberately ending one's own life. It is derived from the Latin term su, meaning oneself, and sidium, meaning killing. Suicide is the 10th leading cause of death. Suicide costs the United States about $69 billion annually in medical and work loss costs. Causes and contributing factors. What causes someone to commit suicide? Mental health disorders are the leading cause for suicide. Of the many mental health disorders, mood disorders are the leading cause of suicide, followed by substance abuse. Another cause of suicide is maladaptive coping with stressful situations. This can lead to a feeling of hopelessness and the belief that ending one's life is the only solution. Another cause or contributing factor is adverse life events such as separation, failed relationships, rejection, physical or sexual abuse, bullying, or life choices that differ from societal norms. As previously mentioned, mental illness is a large contributor to suicide. Morbidity rates of suicide correlate strongly with mental illness diagnoses such as depression, schizophrenia, bipolar, and substance abuse. Affective illnesses such as depression and bipolar account for 50% of all suicides. Coming in a strong second is substance abuse at 25%. Schizophrenia, 10%, and personality disorders account for 5% of suicides. Signs and symptoms. The signs and symptoms of suicide often mimic depression. This is why it is important for individuals to be very vigilant. Signs can be very subtle and often go unnoticed and may include verbal expression of suicide and ideations, giving away valued possessions, writing a will, risky or reckless behavior, drastic changes in mood, self-neglect, excessive sleeping, alcohol or substance abuse, and unusual happiness after a period of depression. Some additional information to note is nationwide morbidity and mortality. Approximately 44,695 Americans die from suicide each year. For every 25th attempt, one person succumbs to a self-inflicted injury. And there's an estimated 666,000 hospitalizations each year. As a nurse, it is important to come up with interventions that may prevent an attempted or completed suicide. Primary interventions include activities that provide support, information, and education to prevent suicide. Educational programs about suicide prevention for healthcare professionals, as it is important for the healthcare professional to be able to identify an individual that is in crisis. Teaching families and friends about signs and symptoms of suicidal ideation. Remember, suicide often mimics depression, so it is important to be able to tell the difference. Peer support groups and discussions about risk and prevention factors. Suicide crisis hotline, awareness campaigns in different communities. Nursing assessment. The basic nursing assessment allows the nurse to know that the appearance, a person's demeanor, and statements being made can be identifiers into where the person's mental state is. Secondary interventions focus on treatment of actual suicidal crises and is usually the determinant of life and death. Suicide precautions include continuous observation and reassessment, flow sheets, safety guidelines, and communication. Counseling interventions include hope installation, coping enhancement, self-esteem enhancement, family mobilization, and support system enhancement. Another secondary intervention would be pharmacological interventions. Remember, mental health and suicide are closely related. Tertiary interventions are geared more towards the family, as most of the times the individuals complete the suicide. Tertiary interventions refer to interventions with the circle of survivors of a person who has committed suicide, also known as postvention. Grief and loss counseling, and nurses should focus on primary and secondary preventative interventions for those affected because the risk of suicide increases for those who have experienced loss through suicide. Quality improvement for suicide prevention includes clinical experience indicating that many patients with suicidal thoughts, plans, or behaviors will benefit mostly from a combination of treatments such as psychosocial intervention and psychotherapies. Suicidal patients should be followed on an ongoing basis to monitor their improvement. Patients with suicidal thoughts, plans, or behaviors should generally be treated in a setting that is less restrictive, as this allows the patient to still be comfortable. Suicide prevention contracts or no harm contracts is a way to improve the quality and prevent suicide. It allows them to put a plan in place when they are feeling like they want to end it all. Psychiatrists need to inquire about past suicidal attempts and self-destructive behaviors, including specific questioning about aborted suicide attempts. Remember, community health is all about research and knowing where you come from in order to know where you are going. If you or someone you know is in emotional distress or suicidal crises, call 1-800-273-TALK or 8255. For veterans, dial the same number and press 1. Now that you've learned all about suicide and its correlation with mental health and the effects that it has on the Caucasian male population, please take a moment to complete the post test by clicking on the link below.